Maintaining healthy habits is crucial for seniors to enjoy an active and fulfilling life. As we age, our bodies change, and adopting certain practices can significantly impact our well-being, both physically and mentally. Here are some key healthy habits for older adults. Maintain a consistent sleep schedule. The golden key to peaceful sleep. Maintaining a consistent sleep schedule goes beyond simply going to bed and waking up at the same time each day. It's a fundamental pillar that helps your body regulate its natural sleep-wake cycle, also known as your internal body clock or circadian rhythm. For older adults, this becomes even more critical as the circadian rhythm tends to become less stable with age. Why is a consistent sleep schedule so important? Stabilizes the circadian rhythm. The circadian rhythm governs many vital bodily processes, including the sleep-wake cycle, hormone release, body temperature, and metabolism. A regular sleep schedule helps reinforce and maintain a healthy circadian rhythm, thereby improving sleep quality. Improves sleep quality. When your body becomes accustomed to a stable sleep routine, you'll find it easier to fall asleep, sleep more deeply, and experience fewer awakenings during the night. This leads to more restorative sleep, leaving you feeling refreshed and energized during the day. Enhances cognitive function. Sufficient and quality sleep is crucial for brain function, including memory, concentration, and problem-solving abilities. A consistent sleep schedule contributes to ensuring you get the necessary sleep to maintain these cognitive functions. Improves mood. Sleep deprivation or irregular sleep patterns can lead to irritability, anxiety, and even depression. A stable sleep schedule helps regulate emotions and improve overall mood. Supports cardiovascular health. Research suggests that inconsistent sleep patterns may be linked to an increased risk of cardiovascular diseases. Maintaining a regular sleep schedule can help protect your heart health. Regulates hormones. Sleep plays a vital role in regulating important hormones like melatonin, the sleep hormone, and cortisol, the stress hormone. A consistent sleep schedule helps maintain the balance of these hormones. Practical tips for maintaining a consistent sleep schedule. Set target bedtime and wake-up times. Choose a bedtime and wake-up time that feels comfortable for you and that you can realistically maintain daily. Adhere to it even on weekends. Try to limit variations in your sleep schedule to no more than 1 hour on weekends compared to weekdays. Significant differences can disrupt your circadian rhythm, leading to social jet lag. Establish a relaxing bedtime routine. Engage in calming and soothing activities in the hour or two before bed to signal to your body that it's time to wind down. Expose yourself to natural light in the morning. Morning sunlight helps reset your circadian rhythm. Try to go outside or sit near a window in the morning. Avoid excessive napping. If you feel tired during the day, try to limit naps to under 30 minutes and avoid napping late in the day. Be patient and consistent. It may take time for your body to adjust to a new sleep schedule. Be patient and try to maintain it consistently. For older adults, establishing and maintaining a consistent sleep schedule may require perseverance and may benefit from support from family members or caregivers. However, the benefits it offers for health and quality of life are immense. Consider it a top priority in daily health management. Optimize your sleep environment, creating a sanctuary for rest. Your bedroom should be your personal haven for sleep. Optimizing this environment means making deliberate choices to minimize distractions and create conditions that naturally promote relaxation and deep sleep. For older adults, a well-optimized sleep environment can significantly contribute to better sleep quality and overall well-being. Key elements of an optimized sleep environment. Darkness is key. Why it matters. Darkness triggers the release of melatonin, the hormone that signals your body it's time to sleep. As we age, our bodies may produce less melatonin, making a dark sleep environment even more critical. How to optimize. Invest in blackout curtains or blinds. These are particularly helpful if you live in an area with bright streetlights or early morning sun. Eliminate electronic light sources. Turn off or cover any blinking lights from electronics like TVs, chargers, or alarm clocks. Even small amounts of light can interfere with melatonin production. Consider an eye mask. If complete darkness is difficult to achieve, a comfortable eye mask can be a simple and effective solution. Quiet and peaceful. Why it matters. Noise pollution can easily disrupt sleep, leading to awakenings and lighter sleep stages. Seniors may be more sensitive to noise. How to optimize? Use earplugs. High-quality earplugs can block out a significant amount of ambient noise. Experiment with different types to find a comfortable fit. Consider a white noise machine or fan. Consistent background noise can help mask disruptive sounds. Choose a sound that is soothing and not jarring. Address external noise sources. If possible, try to minimize noise from outside, e.g., closing windows, using weather stripping. Talk to household members. If you live with others, communicate your need for a quiet sleep environment. Cool and comfortable temperature. Why it matters. Your body temperature naturally drops slightly when you sleep. A cool room, typically between 60 to 67 degrees Fahrenheit or 15 to 19 degrees Celsius, facilitates this process and promotes deeper sleep. Older adults may have more difficulty regulating their body temperature. How to optimize? Adjust your thermostat. Lower the temperature in your bedroom before going to sleep. Use breathable bedding. Choose natural fabrics like cotton or linen that help regulate body temperature. Consider a fan. A fan can help circulate air and create a cooling effect. Comfortable and supportive bedding. Why it matters. An uncomfortable mattress or pillows can lead to aches, pains, and restless sleep. Proper support is crucial, especially for older adults who may have pre-existing musculoskeletal conditions. How to optimize? Invest in a supportive mattress. Choose a mattress that provides adequate support for your spine and pressure points. Consider your preferred sleeping position. Side, back, stomach. Select the right pillows. Your pillow should support the natural curve of your neck and keep your head aligned with your spine. Experiment with different shapes and firmness levels. Use comfortable and clean bedding. Ensure your sheets, blankets, and comforter are clean, soft, and made of breathable materials. A tidy and safe space. Why it matters. Clutter can create a sense of unease and make it difficult to relax. A clear path is also essential for safety, especially during nighttime trips to the bathroom. How to optimize? Keep your bedroom tidy. Regularly declutter and organize your bedroom to create a calm and peaceful atmosphere. Ensure clear pathways. Remove any obstacles that could lead to trips or falls, especially between your bed and the bathroom. Consider a nightlight. A soft nightlight can provide enough illumination for safe movement without disrupting sleep. Senior-specific considerations for optimizing sleep environment. Accessibility. Ensure the bed height is comfortable for getting in and out easily. Consider grab bars if mobility is an issue. Temperature sensitivity. Older adults may have varying temperature preferences. Use layers of bedding that can be easily added or removed. Air quality. If allergies or respiratory issues are a concern, consider using an air purifier. Familiarity. While optimizing, try to maintain a sense of familiarity and comfort, especially if there have been recent changes in living arrangements. By thoughtfully addressing these aspects, you can transform your bedroom into a sanctuary that promotes restful, safe, and rejuvenating sleep, which is essential for maintaining good health and vitality as you age. All right, let's explore the importance and practical steps of establishing a relaxing bedtime routine, particularly beneficial for seniors aiming for better sleep. Establish a relaxing bedtime routine, preparing your mind and body for rest. A relaxing bedtime routine is a sequence of calming activities you perform consistently in the hour or two leading up to sleep. This routine acts as a signal to your brain and body that it's time to wind down and prepare for rest. For older adults, who may experience more fragmented sleep and have a more sensitive sleep system, a predictable and soothing routine can be incredibly valuable. Why is a relaxing bedtime routine so effective? Signals the body and mind. Consistent pre-sleep activities create a mental and physical cue that sleep is approaching. This helps to slow down brain activity and relax muscles. Reduces stress and anxiety. Engaging in calming activities helps to alleviate the day's stresses and worries, making it easier to drift off to sleep without a racing mind. Promotes relaxation. Activities like reading, gentle stretching, or warm baths can physically relax the body, easing tension and promoting sleepiness. Improves sleep onset. By preparing your body and mind, A routine can shorten the time it takes to fall asleep. Enhances sleep quality. When you fall asleep in a relaxed state, you're more likely to experience deeper and more restorative sleep. Effective elements of a relaxing bedtime routine for seniors. Digital detox. Why it matters? The blue light emitted from electronic devices, phones, tablets, TVs, suppresses melatonin production and stimulates the brain, making it harder to fall asleep. What to do? Power down all electronic devices at least 1 hour before bedtime. Resist the urge to check emails or social media. Quiet and calming activities. Why it matters? Gentle activities help to slow down your heart rate and brain activity. What to do? Read a physical book. Choose something light and enjoyable, not too stimulating or work-related. Listen to soothing music or podcasts. Opt for calming instrumental music, nature sounds, or relaxing spoken word content. Engage in light hobbies. Gentle activities like knitting, puzzles, or adult coloring can be relaxing. Gentle stretching or relaxation exercises. Why it matters? These practices can ease muscle tension and promote a sense of calm. What to do? Perform gentle stretches. Focus on slow, controlled movements that don't strain your body. Practice deep breathing exercises. Slow, deep breaths can help to calm your nervous system. Try progressive muscle relaxation. Tense and then release different muscle groups in your body. Consider meditation or mindfulness. Even a few minutes of quiet meditation can help to clear your mind. Warm bath or shower. Why it matters? The warmth can relax your muscles, and the subsequent drop in body temperature after getting out can signal your body that it's time for sleep. What to do? Take a warm, not hot, bath or shower about an hour before bedtime. Consider adding Epsom salts for muscle relaxation. Warm beverage, caffeine-free. Why it matters? A warm drink can be comforting and promote relaxation. What to do? Opt for caffeine-free options like herbal tea, chamomile, valerian, passion flower, warm milk, or decaffeinated tea. Avoid sugary drinks. Personal hygiene. Why it matters? Completing your nighttime personal care routine can be a signal that the day is ending. What to do? Brush your teeth, wash your face, and get ready for bed. Create a comfortable atmosphere. Why it matters? Your surroundings can significantly impact your ability to relax. What to do? Dim the lights in your bedroom, ensure a comfortable temperature, and make sure your bedding is cozy. Senior-specific considerations for a bedtime routine. Timing. Allow ample time for your routine, especially if mobility is a factor. Don't rush. Consistency. The key is to perform your chosen activities in the same order each night to strengthen the association with sleep. Individualization. What is relaxing varies from person to person. Experiment to find activities that work best for you. Avoid stimulating activities. Steer clear of intense conversations, stressful topics, or engaging in mentally demanding tasks close to bedtime. Medication timing. If you take nighttime medications, ensure they are incorporated into your routine at an appropriate time. By consistently engaging in a relaxing bedtime routine, seniors can significantly improve their sleep quality, reduce nighttime awakenings, and wake up feeling more rested and refreshed. It's a simple yet powerful tool for promoting healthy sleep habits. Pay attention to diet and lifestyle, fueling restful nights. The foods we eat and the way we live our lives have a profound impact on our sleep patterns. For older adults, whose bodies may be more sensitive to dietary and lifestyle factors, making conscious choices in these areas can significantly contribute to better sleep quality and overall well-being. How diet affects sleep. Timing of meals. Why it matters. Eating heavy meals too close to bedtime can lead to indigestion, heartburn, and discomfort, making it difficult to fall asleep and stay asleep. What to do? Aim to finish your last meal at least 2 to 3 hours before going to bed to allow your body time to digest. Opt for lighter evening meals. Specific foods and nutrients. Why it matters. Certain foods and nutrients can either promote or hinder sleep. What to do? Include tryptophan-rich foods. Tryptophan is an amino acid that the body uses to produce serotonin and melatonin, both important for sleep. Good sources include turkey, chicken, milk, and pumpkin seeds. Ensure adequate magnesium intake. Magnesium helps relax muscles and nerves. Foods rich in magnesium include leafy green vegetables, nuts, and whole grains. Consider calcium-rich foods. Calcium helps the brain use tryptophan to manufacture melatonin. Dairy products, leafy greens, and fortified foods are good sources. Limit sugary and processed foods. These can cause blood sugar spikes and crashes, leading to energy fluctuations and disrupted sleep. Caffeine and alcohol. Why they matter. Caffeine, a stimulant that can keep you awake and interfere with sleep onset and quality. Its effects can last for several hours. Alcohol. While it may initially make you feel drowsy, it can lead to fragmented sleep later in the night, reduce REM sleep, and worsen sleep apnea. What to do? Limit caffeine intake. Avoid caffeinated beverages, coffee, tea, soda, energy drinks, especially in the afternoon and evening. Avoid alcohol before bed. It's best to avoid alcohol altogether close to bedtime. How lifestyle affects sleep. Regular physical activity. Why it matters. Regular exercise can improve sleep quality and duration. However, the timing is crucial. What to do? Aim for at least 30 minutes of moderate intensity exercise most days of the week. Avoid intense workouts too close to bedtime, at least 3 hours before. Gentle activities like walking or stretching in the evening can be beneficial. Hydration. Why it matters. Dehydration can lead to discomfort and disrupt sleep. What to do? Drink enough water throughout the day, but limit fluid intake in the hours leading up to bedtime to minimize nighttime trips to the bathroom. Stress management. Why it matters. Stress and anxiety are major culprits in sleep disturbances. What to do? Incorporate stress-reducing techniques into your daily routine, such as meditation, deep breathing exercises, yoga, or engaging in enjoyable hobbies. Sunlight exposure. Why it matters. Exposure to natural light, especially in the morning, helps regulate your circadian rhythm. What to do? Try to spend some time outdoors in the sunlight each day, ideally in the morning. Smoking. Why it matters. Nicotine is a stimulant that can interfere with sleep. Smoking can also worsen respiratory conditions that disrupt sleep. What to do? If you smoke, consider seeking help to quit. Senior-specific considerations for diet and lifestyle. Medication interactions. Be aware that some medications can affect appetite, digestion, and sleep. Discuss any concerns with your doctor. Changes in metabolism. As we age, our metabolism slows down, so it's important to be mindful of portion sizes and the types of foods we consume. Nutrient absorption. Older adults may have reduced nutrient absorption. Ensure a diet rich in essential vitamins and minerals. Physical limitations. Adapt your exercise routine to your physical abilities. Even gentle activities can be beneficial. Social engagement. Maintaining social connections and engaging in meaningful activities can reduce stress and improve overall well-being, indirectly benefiting sleep. By paying conscious attention to your diet and adopting a healthy lifestyle, you can create a foundation that supports restful and rejuvenating sleep, contributing significantly to your health and vitality as a senior. Monitor your health and underlying conditions. A proactive approach to peaceful sleep. As we age, the likelihood of developing underlying health conditions increases, and these conditions can significantly impact our sleep patterns and overall well-being. Proactively monitoring your health and effectively managing any existing conditions is paramount for ensuring restful and safe sleep. Why is monitoring health and underlying conditions important for sleep? Direct impact on sleep. Many medical conditions can directly disrupt sleep. For example, chronic pain, arthritis, neuropathy can make it difficult to find a comfortable sleeping position and cause nighttime awakenings. Cardiovascular issues, heart failure, angina may lead to shortness of breath or chest pain at night, disrupting sleep. Respiratory conditions, COPD, asthma can cause coughing, wheezing, and breathing difficulties during sleep. Neurological disorders, Parkinson's disease, restless leg syndrome can cause involuntary movements or discomfort that interfere with sleep. Gastrointestinal problems, acid reflux, IBS can cause nighttime discomfort and awakenings. Endocrine disorders, diabetes, Thyroid problems can affect sleep through hormonal imbalances and other symptoms. Mental health conditions, anxiety, depression often have a significant impact on sleep quality and can lead to insomnia. Medication side effects. Many medications prescribed for underlying conditions can have side effects that interfere with sleep, such as insomnia, drowsiness during the day, or frequent urination at night. Increased risk of sleep disorders. Certain health conditions can increase the risk of developing specific sleep disorders, such as sleep apnea, common in individuals with heart conditions or obesity, and restless leg syndrome, associated with iron deficiency and kidney disease. Early detection and management. Regular monitoring allows for the early detection of new health issues or changes in existing conditions that could be affecting sleep. Prompt management can often alleviate or minimize these sleep disturbances. Preventing complications. Effectively managing underlying conditions can prevent them from worsening and leading to more severe health problems, some of which could be life-threatening during sleep, e.g., severe cardiac events exacerbated by poor sleep. Practical steps for monitoring your health and underlying conditions for better sleep. Regular medical checkups. Schedule and attend regular checkups with your primary care physician. Discuss any changes in your sleep patterns or any new or worsening symptoms you are experiencing. Open communication with your doctor. Be honest and thorough when describing your sleep habits and any sleep-related problems. Don't hesitate to ask questions about how your health conditions and medications might be affecting your sleep. Adhere to treatment plans. Follow your doctor's recommendations for managing your underlying conditions, including taking medications as prescribed, making recommended lifestyle changes, and attending follow-up appointments. Medication review. Regularly review your medications with your doctor or pharmacist to identify any potential sleep-disrupting side effects. Explore if there are alternative medications with fewer sleep-related issues, if appropriate. Monitor symptoms. Pay close attention to any symptoms related to your underlying conditions, especially those that seem to worsen at night or interfere with sleep. Keep a symptom diary if helpful. Be aware of new symptoms. Be vigilant for any new symptoms that arise, even if they don't seem directly related to your known conditions. These could indicate a new health issue affecting your sleep. Consider a sleep study. If you experience symptoms suggestive of a sleep disorder, e.g., loud snoring, gasping for air during sleep, excessive daytime sleepiness, your doctor may recommend a sleep study, polysomnography, to get a comprehensive evaluation of your sleep. Manage pain effectively. If chronic pain is affecting your sleep, work with your doctor to develop an effective pain management plan that may include medication, physical therapy, or other therapies. Mental health awareness. Recognize the strong link between mental health and sleep. If you are experiencing symptoms of anxiety or depression, seek professional help. Treatment can often improve both your mood and your sleep. Educate yourself. Learn about your specific health conditions and how they can impact sleep. This knowledge empowers you to have more informed conversations with your doctor and take proactive steps to manage your sleep. By actively monitoring your health and diligently managing any underlying conditions, you are taking a crucial step towards ensuring more restful, safe, and rejuvenating sleep as you age. This proactive approach not only improves your sleep quality but also contributes significantly to your overall health and well-being. Be aware of nighttime risk factors. Sleep apnea. If you or your loved ones suspect sleep apnea, loud snoring, gasping for air during sleep, daytime fatigue, consult a doctor for diagnosis and treatment, which may include CPAP, continuous positive airway pressure therapy. Cardiovascular issues. Individuals with a history of heart problems should be particularly vigilant for symptoms like chest pain or shortness of breath at night and seek immediate medical attention if they occur. Sleeping position. Some studies suggest that sleeping on your back can worsen sleep apnea in some individuals. Try sleeping on your side. Medications. Certain medications can affect sleep or increase the risk of cardiovascular events. Discuss your medications with your doctor. Ensure bedroom safety. Install nightlights with a soft glow for safe navigation during nighttime trips to the bathroom to prevent falls. Remove any tripping hazards from the floor. Keep a phone within easy reach to call for help in case of an emergency. Senior advice for the elderly and caregivers. Listen to your body. Pay attention to any changes in your sleep patterns or overall health and don't hesitate to seek medical advice. Be patient and consistent. Changing habits takes time. Be persistent in implementing these recommendations. Promote mental well-being. Avoid stress and anxiety before bed. Share your worries with loved ones or seek psychological support if needed. Caregivers play a crucial role. Observe the sleep patterns of elderly individuals. Identify any unusual signs early, and support them in adopting healthy sleep habits. Good and sufficient sleep is vital for the health and quality of life of older adults. By adopting these simple yet effective habits, we can help our loved ones enjoy restful nights and minimize the risk of unfortunate events during sleep. Always prioritize their comfort and well-being when it comes to sleep.